Let's bring in Dr. Bawa. Thanks for joining us, Doctor. Can you just explain exactly what is a liquid BBL and how it differs from a surgical procedure?
Yes, absolutely. And firstly, Dane, I'm really sorry to hear of your loss. It's tragic.
Yeah.
And the difference between a BBL, so a liquid BBL, is when we take a soft tissue filler or a dermal filler and we use that and inject it into the buttocks to volumize. Now, when we use this type of dermal filler in the face, and we do it very safely, but the amount of volume that is put into the buttock region is very, very high, up to 1 liter for each buttock at a time. And just to give you some perspective, let's say if I'm doing a treatment for a nose using dermal filler, I'll use maybe 1/2 ml. So you can see it's very, very high volume. Now, compared to the surgical BBL, that's when fat is taken using liposuction and transferred into the buttocks to, again, create that volume and contour.
And what are your concerns here, as a professional and, working in the clinic?
Yeah, I think the biggest thing is safety for patients, and being treated in an unsafe space where there is no sterility is the first problem. Also, anatomical knowledge. So as you guys just mentioned, people can go on a 1-day course and then set up a clinic in their own home. Now, what happened recently in 2018, where one of the plastic surgical bodies, BBLs, they said that even plastic surgeons shouldn't be doing the surgical BBL because of the risks. And then what they did in 2022 was to give further advice that these treatments should only be done in a proper theatre, in a hospital, under ultrasound guidance. So you can see the problems that can occur. And so going back to safety, understanding the anatomy of the region and the volume that people are putting in, it is just, it can be a disaster, as we've seen.
Yes. Well, thank you so much for joining us this morning, Dr. Bawa.
Thank you.